committee. So topic given is to me is the obesity and in the adolescent obesity. So obesity epidemic is now we all know that is a worldwide prevalence of obesity that has been increased. So obesity is now a global health threat, and we see that 1 in every 3 children is obese and 3.4 million deaths that is caused by the overweight and obesity. So obesity and overweight increased 27.5% in adults, while 47.1% in the children after the 1980s. So we all know that who are the adolescents. That is, early adolescents are 10 to 14 years, while late adolescents are from 15 to 19 years. So what is the difference? Since morning we are hearing all the consensus on the TDM and diabetes and pregnancy, and we all got into very important diseases. Now, we are starting with obesity. Advanced scientific facts on adolescence and obesity are there. Adolescence is a critical biological window. This is very important because adolescence is now recognized as the second major developmental programming period after the first 1,000 days of the puberty, which induces profound changes in insulin sensitivity, in body composition, in appetite regulation, in neuroplasticity, and epigenetic programming. So obesity acquired in adolescence has a significantly higher likelihood of persisting into the adult compared with obesity acquired in life. So we give more importance to obesity which is being acquired in the adolescence. Key facts is approximately 80% of the adolescents with severe obesity continue to have obesity in adulthood. What are the sustainable developmental goals that we all know? We have to target by 2030. That is, now the obesity that comes under the malnutrition. So we have to control 2.2% commits the world to ending all the forms of malnutrition by 2030, including overweight and the obesity. So it also targets 3.4% commits the world to reduce premature deaths from non-communicable disease, because now obesity is also one of the very important non-communicable disease. So what are the factors why we say that puberty is a period where there are many physiological changes that happens. These are the insulin resistance. A fascinating physiological phenomena is that during mid-puberty, the insulin sensitivity naturally decreases by approximately 25 to 30%. And this physiological insulin resistance is believed to facilitate growth and sexual maturation. So this physiological insulin resistance is for the benefit. However, when the obesity is superimposed on this physiological insulin resistance, what happens then? There is hyperinsulinemia, which worsens, and there is hepatic steatosis, which develops, and PCOS risk that increases. Type 2 diabetes that appears much earlier in these very cases. This explains why puberty is the common period for the emergence of 3 diabetes. Metabolic diseases, these are PCOS and metabolic syndrome. So this we have to teach to our adolescents that let us measure our fitness. How can we measure? By the BMI index, we all know, by the waist circumference, by measuring aerobic fitness, by the muscular strength, by the sit and reach flexibility, by sit up test back muscle strength. These are 2 tests which they should all do. Most common is BMI. BMI is, as we all know, weight in kg upon height in meter square. So if we take underweight, that is below 18.5, normal is 18.5 to 24.9, overweight is 25 to 39.9, while obese is from 30 to 34.9, and extremely obese is more than 35. So adolescent obesity is now considered as a primarily neuroendocrine disease. It's considered as a disease. So modern obesity science that views obesity as a disorder of hypothalamic energy regulation. The hypothalamus receives signal from leptin, from ghrelin, from GLP-1, from PYY, from insulin. Because in obesity, the leptin levels are elevated. So the brain develops leptin resistance. This is very important fact. Therefore, the problem is often not the lack of willpower, but impaired central regulation of the hunger and satiety. The same way, peptide YY is a gut hormone which is released after eating that signals fulfillment to the brain. In obesity, what happens? In obesity, this system is often impaired. So individuals frequently have lower circulatory PYY levels and they have a blunted satiety. Satiety response and causing them to eat more and more calorie before they feel satisfied. So the adolescent brain is uniquely vulnerable. In this, MRI studies, they show that obesity that alters reward pathways, it alters the executive control center, it alters the dopaminergic signaling and particularly affecting the mesolimbic dopamine circuit, which includes nucleus accumbens, ventral tegmental areas, which include these changes. They resemble the pathway involved in addiction. Some researchers now describe ultra-processed food exposure as a causing food reward regulation. This is very well shown in this figure, hypothalamic hunger system and mesolimbic reward system. So obesity accelerates the biological aging. This is very important fact which we all see. Recent studies demonstrate that adolescent obesity show evidence of epigenetic age acceleration and telomere shortening and increased inflammatory signatures. This means that a 16-year-old adolescent with severe obesity may have biological markers resembling those of significantly older individuals. So chronic inflammation begins in childhood. Adipose tissue is now recognized as an endocrine organ. So obesity causes macrophage infiltration, it causes TNF-alpha release, it causes IL-6 production and CRP elevation. This all, what does it all? This all results in a state of chronic low-grade inflammation. This term is known as meta-inflammation. This inflammatory process begins years before the clinical disease appears. So that is the reason we want to control the adolescent obesity. How does adolescent obesity alter the reproductive function? Somebody asked, yes. Even starting from this stage, it alters the reproductive function. In girls, what does it cause? The obesity that increases the insulin resistance and stimulates the ovarian androgen production and reduces the SHBG and leading to hyperandrogenism and anovulation, menstrual irregularity and even PCOS. So many obese girls, they are adolescents coming to us in our resolve symptoms. PCOS is always detected in them. Studies suggested that up to 60 to 70% of adolescents with PCOS have excess weight of obesity or obesity. So obesity affects the fertility before the adulthood. This is a very important point. Even during the adolescence, evidence suggests that it reduced ovarian reserve markers are there and altered AMH patterns is there. There is increased ovarian inflammation. Gut microbiome is very important also. That is emerging as a major player. So adolescents with obesity, they exhibit reduced microbial diversity. Therefore, the role of gut microbiome is coming now more and more in our science. Increased bacteriocides, pollutants and bacteriocides ratio is there. There is altered short chain fatty acid production and microbiota. What they do? They influence satiety signaling and GLP-1 secretions. They affect the insulin sensitivity. They affect the inflammation. Some researchers call obesity as a disease of gut-brain axis. This diagram that shows that the gut flora, when it is disturbed, they reproduce as a obese child, while the gut biota, where it is balanced, they are a normal, healthy offspring is born. So sleep is a powerful metabolic hormone. Other thing is the relation with the sleep. 1 hour less sleep is associated with increased ghrelin, which causes reduced leptin and higher caloric intake. So adolescents sleep less than 7 hours have significantly greater risk of modern contributor of the mobile. What are the contributors? These are the mobile phone. These are the blue light exposure and social media use. These all can cause less sleep and that in turn induces the obesity. Ultra processed food alter the appetite biology. Ultra processed food are engineered for hyperpalatability, rapid gut gastric counting and with the reward activation. So clinical feeding studies demonstrate that individuals consuming ultra processed diet, as we see in all the adolescents, they eat approximately 500 kilocalories per day, more than those consuming minimally processed diet despite the similar macronutrients. So it also depends on the home environment. Is this the right home environment or that is the right? This is the right home environment because the children's food choices are also influenced by the family needs. The lack of parental guide considering their busy schedule as a result of their tight working shifts. So it is easy to prepare healthy meals than to treat children obesity. That is said by one of the philosophers. Food choices. Now, because the fast food industry is growing so, this is also a fault for the rise of child obesity, as we all see. In addition, the fast food restaurants give out choice in the children's meal, which help to entice children by fast food. That we all agree. So obesity is associated with early puberty and all these diseases. The heart disease chances are more, hypertension, osteoarthritis later on, obstructive sleep apnea, hyperlipidemia and diabetes and many other diseases later on in the life. So especially in the girls, there is increased leptin, hyperlipidemia, altered spectrin signaling. These all are responsible. So what does it cause? There are consequences of early menarche. There are longer lifetime insulin exposure. There is increased future risk of breast cancer and even endometrial cancer and PCOS. So the liver is often the first organ which is damaged by MASLD. What is MASLD? This is a metabolic dysfunction associated with steatotic liver disease, which affects up to 1/3 of the adults. the obesity. Many are asymptomatic. So liver fibrosis can already be present even before adulthood in these all persons. Cardiovascular diseases, they begin in obese teenager. So autopsy studies from the historic Boganza heart study, that is very important heart study, which showed that there are fatty streaks in liver of these patients. There are early atherosclerosis. There is cardiovascular disease actually begin decades before clinical event occur. This is very important point. And GLP-1 agonists are changing the field, and there are new evidence from. We are all talking now about the semaglutide, terzepatide, which demonstrates that significant weight reduction that happens with these medicines. We all know that many of us must be taking Bujalo. Improved insulin sensitivity, reduced liver fat, better quality of life. So for the first time, obesity treatment is targeting the biological drivers rather than merely advising lifestyle changes. So obesity is an intergeneration disease now. It is that maternal obesity before conception can alter fetal metabolism, it can alter epigenetic signature, it can alter the appetite regulation pathway. This concept is very important and is now known as developmental origin of health and disease. This is a developmental origin of health and disease, and the obesity epidemic may therefore be transmitted biologically across generations. So we all know how fluent we used to talk, but do we apply it in our day-to-day life? It should be proper diet. Prevention is by the proper diet, by the legal laws, by improved home environment, physical exercise. And coming on the conclusion, adolescent obesity is not merely excess weight. Now it is a complex neuroendocrine, inflammatory, metabolic, reproductive, and developmental disorder, which is occurring during a critical period of human plasticity. Every adolescent with obesity represents not only a current health challenge, but a future burden of diabetes, infertility, cardiovascular disease, and intergenerational metabolic dysfunction. So the global clinical consensus on adolescent obesity frames it as a complex, progressive, chronic disease rather than a behavioral failure. Shift to early proactive intervention. No watchful waiting. Consensus guidelines strongly reject the old wait and see if they grow out of it approach. High persistence, up to 80% of the adolescents with obesity continue to have obesity into the adulthood, compounding lifetime health risk. So immediate treatment is very important. Care should begin immediately upon the diagnosis to address physiological changes before the adulthood. So thank you very much. Obesity is no laughing matter. But a good medical code is obesity is not because it runs in family, but it is because